The second thing I would like to mention on this JCAD dialogues and reviews is in December of 2024. JCAD put out a supplement on vitiligo, focusing on two representative cases from two dermatologists that are leaders in the area of vitiligo. When I say leader, they're in there seeing a lot of the patients, they're publishing a lot, they're collecting data, and that's Dr. Pearl Grimes, who we know for quite some time now, a leader in vitiligo that has a Center for Pigmentation and Vitiligo in Southern California. It was a pleasure having her input, and also Dr. Iltafat Hamzavi, who is at Henry Ford in Detroit, also a leader in this particular area of vitiligo. And we had an exchange, um, moderated and directed by the three of us. I do a fair amount of research in vitiligo and know a fair amount about it, but I'm not Pearl Grimes and I'm not Iltafat Hamzavi. They have a lot of depth. So we published, and it's December 2024 supplement, but it was mailed with the January 2025 issue of JCAD. And you can certainly find it through the website, and there are a lot of announcements about it. It is worth the read. There's a lot of practical information on how to assess the disease, what comorbidities to think about, what laboratory testing will make it facile. This is written for the clinicians, not for the research centers or major centers that are treating these patients, but how to help you in the trenches evaluate and manage vitiligo, things that you can do to help your staff get up to speed, and then looking at some representative cases to walk through the challenges that we commonly see. And they talked about the value of certainly topical therapies. We have topical ruxolitinib cream, the 1.5% twice a day under the brand name of Opzelura. We have other topical therapies that have been used, and also oral agents. We have oral Janus kinase inhibitors that are under evaluation. Uh, there may be situations where they are implemented that are more refractory cases, but the combination with a phototherapy, especially narrowband UVB, and how that can be helpful. And also adjunctive therapies, uh, measures such as oral antioxidants, because oxidative stress is identified as a major component to triggering vitiligo. So I'm just touching upon some of the areas that are very cohesive, maybe more cohesive than my explanation here, that if you sit down and read this, take the time to read it. It's not excessively long. You can get through it in a reasonable amount of time. There's very valuable information. So that's another program and project that we have brought forward from JCAD. So thank you very much. I hope this JCAD dialogues and reviews uh, brings you up to date on some things that are going to help you in your practice.